It is 9 o'clock.
All right, 9 o'clock. I gotta get my microphone on here. Good morning, everyone. It's 9 a.m. It's time to call the Cottington County Commission meeting to order for August 1. Boy, the summer is going by quickly, isn't it? August 1 already. A couple of housekeeping chores here. If you have a cell phone, please mute it or turn it off. If you've got a call that comes in that you need to take, please go out into the rotunda and take it so you don't disturb the meeting. The other is that this meeting is being streamed live, so if you ask to speak, more than likely you will be on camera. That being said,
Move to approve the agenda.
We have a motion by Hatton to approve the agenda.
Second.
Second by Gable. Also, if you go down to item number 8, Mr. Gable has asked if he's not ready for that one yet, so you can remove item number 8 from the agenda. With that information, we have a motion. All in favor indicate by saying aye.
Aye.
Opposed, same sign. Motion carries. Motion to approve
Move
the
to
July
approve is
25th.
emailed.
And that motion was made by who?
I just
Brenda.
made it.
I'll second it.
And
I'll second it.
Commissioner Hatton and Commissioner Gable second. Any discussion? Any comments? Any discussion? Seeing none, all in favor indicate by saying aye.
Aye.
Opposed, same sign, motion carries. Veteran Service, good morning, Al.
Good morning now.
Thank you.
Morning now.
Good morning, everybody.
Good morning.
For the month of July, we had 3 trips to Sioux Falls with 9 riders. We had 93 walk-ins / appointments, and we had 6 home visits, including nursing homes, assisted living, and home visits. We received our updated expenditure list from the VA of what comes into Cottington County every year, and I'll give each one of you folks the report. The highlighted area is what Cottington County receives. And currently we are at $12.568 million.
Thank you.
Comes into Cottington County each year as far as benefits go, either cash or educational, healthcare, or whatever. The actual cash that comes in is $5.781 million, and that's an increase of over $200,000 from our last report. And we lost about, 59 veterans in 1 year that are receiving benefits, but we're still, a lot of money is still coming into Cottington County, which is great.
Good.
Any questions?
Any questions for Al?
So, Mr. Chairman, so this is VA money or state money? I'm sorry.
VA money.
Okay.
Federal money. Yep.
Okay.
Anything else? Any other questions for
Just
Al?
one other question, just out of curiosity. You mentioned home visits and hospital visits. What typically, what's the nature of that kind of visit?
They're not able to come to the office.
So they just have some question about their benefits?
Questions, or I go there and get, fill out forms,
Okay.
get signatures, things like that.
Okay. Yeah, thanks.
Any other questions, comments? Seeing none, thank you, Al.
Thank you.
Thanks, Al.
Have a good day. All right, welfare. Sarah. Good morning, Sarah.
We don't know who's going first or not. I don't think we make it to them.
So for June, we had 29 people that were served. We had a higher caseload of medical, same with July. We had 3 of those medical clients were resolved with health insurance, and so the savings that we look at is the cost of what their full health insurance versus what the programs we got them on would be costing. It doesn't reflect any medical expenses that we would had. One has cancer, both of them, all of them had surgery, upcoming surgery, so it doesn't reflect those. We don't track that on that. So your sheet, because I put the asterisk behind the 8, the bottom total didn't drop down, so that's why that's penciled in on that. We had 44 people utilize Caremark, and so a cost savings of about $3,000 on that. For the Stepping Up June highlights, we had our meeting June 9th. We had a presentation from Johnson County, Iowa on their diversion program. We launched the Behavioral Health Deflection Program. We currently have 2 people enrolled in that program, working through some tweaks on how to get people engaged. We've been working through that. Still working on the preparations for the sequential intercept mapping workshop. We've got the questionnaire completed. Our invitation list is almost completed. And then the data is about two-thirds through that they're asking for. The way the system is set up, a lot of it we're having to go in by hand and do some of that. And we have a first draft of a resource directory that we hope to utilize with these programs as well. Some of the stuff that I was just going to, a lot of times I bring up stories of individuals and stuff, but this time I thought there's things that we always aren't reported and stuff. And one that we had a couple years ago, the individual who purchased the Palace apartment actually happened to be my daughter's professor. And that professor was wanting to eliminate the current clientele and change the whole structure of those Palace apartments. So I would make a point to reach out to him, and when I would visit my daughter, and then on my own time I would ask him out for coffee. And we had several conversations, learning a little bit about what his goals are, what he was wanting to do, but also communicating to him for us that serves a population. And it serves a need, and just talking about that if those clients are evicted or changed, where would they go? And so we discussed several ideas and just kept in that communication loop so that we would be aware as if those changes took place. Over time, for himself, it wasn't worth it, the changes in the requirement. And so in the end he came up with a solution that to help house individuals that minimized his risk, and there was no cost to the county to serve this population. So I don't get that. I used to have a lot of people from that Palace Apartments, and now we're not really getting that. They do the referrals to the energy assistance, their manager, they work with them, they do some case management. They also do things that then can get them housed without county dollars. And a lot of that is most individuals that we work with, their situation, it's a situational, that they're able to get themselves out. The chronic is very few that we work with. The other thing too, I actually had a colleague from NACO had texted me when I didn't attend this last meeting, but just as a reminder too, is when I first started at that health steering committee, that was back when the Affordable Care Act was looking at getting passed. And that I myself didn't support the Affordable Care Act, but NACO did. But you just let democracy take place. And we talked a lot about different ideas of, there was the concerns and stuff, and then I had suggested an idea of, is there a way to protect counties when this Affordable Care Act gets passed? Someone else took and ran with that, and through collaboration, language was added to the federal health bill that would not allow states to pass additional burdens or costs to the county that weren't there before the Affordable Care Act. And that was a huge protection for many counties, especially other states probably saw it more because they actually do a percentage, but it really protected additional costs coming from that. So those are just things that aren't measured ever in the report that I think are valuable, that I don't know how you would report on that. Just a couple notes on the 2018 budget review last month and stuff. It's just wanting to point out that the request for 2018 is $2,040 less than 2017, and the total budget increase in the last 10 years is less than 10%. We've been using the concept of pay for success, and basically we don't have the ability to do that. Basically what the pay for success concept model is you don't pay for services from a vendor unless they prove that they were successful. That's quite a bit larger than what even our population of our county can do, but what we do is we know that So taking that concept and saying where we've saved money, we know that there are still needs in our community, we're not meeting them, but the question always becomes, how do you do that without breaking the county? Because if we laxed up on some of our policies, it would really tilt. We've seen that. We've seen it just tilt other areas. When stimulus money came in, it went very fast and very quickly because you open up those things that person wouldn't qualify. Spent really fast. Same with Salvation, and then didn't resolve the issue. Same with Salvation Army. They found that they tried doing a housing first model, and they couldn't maintain it because you can easily get people in housing. You can't help them always stay. It was too expensive. They've dropped the whole program. So for us, it becomes the question is how do we meet those in need and do it in a manner that's fiscally responsible? And you will never solve everything, and we know that. But we also know most cases are situational. Is there something we can do with that? And also there's a few that are chronic. So how do we do that? And what we have found, and federally, a lot of budgets are cut because you can't prove what you're doing is working. Even on the federal level, it's always challenged because that isn't tracked. But the one thing that they do show is case management is very effective. It allows a program, you can individualize, you can meet that need. It's not a one-size-fit-all. It just is not. It's very complex. But you can walk with that person, but you can let that person walk away, and you offer those opportunities. And so that also helped us identify where are our barriers, what do we have needs. A lot of people want to do a shelter or a halfway house. And I'm saying that's too big of a leap. We need to first start with something we're not even doing. And that's where the whole concept of everything we're doing. What needs can we meet at the most minimum? And that's always been that with that case management. So part of it then was, okay, if you're looking at a pay for success, there was savings through the welfare office, how do you go about that? Well, you first want to work with those programs where you can have reduced savings, because we know as we begin to work with that, we're going to have programs that are going to be cost neutral. And if we start with the cost neutral programs, we wouldn't have that ability to kind of do the savings. So that's kind of what the concept that we started with. That was the reason, like with the jail. The anticipation is that we will have cost savings, and once those savings are there, that can get moved over into those budgets. Then you can take those savings and work on the next step. It's a very long process. I mean, it took us 5 years to get the utility thing straightened out. It's not slow, but it's a very long term. As you think about that, if you eat up the money that's cost neutral now, you don't have it for the future. So that's a little bit of an idea of where some of that hopefully helps understand the thinking of the process and the steps and the orders. First, start at those savings. When we first started here, the jail medical was extremely high compared to other counties. That's where we started looking at, well, what does your county do? I worked with Sheriff Keith at that time. We worked on getting it so that it's cost ratio. Now it's just automatic, just like with the utilities. We work a little bit, it's just automatic, and then it just transitions in that time. So that's kind of those overall, areas, but definitely you have a generalized concept of where we're at and what the problems are, but we really kind of need to nail it down and say, what is it? What are the needs? And I could identify one is birth certificates. If someone is in a situation and they can't get a birth certificate and they need that birth certificate because they need that income-based housing, it's a very minimal cost. So we, have worked and reached out to a few people. Can you help with that? Because it requires, usually a check up front to have. So what is a birth certificate? $15 each? $20? Very minimum cost that resolves long term. So those are the things that we look at. What is something that we can do that helps somebody long term? So on that, just those nudges to help with that. So.
Okay, any questions for Sarah? Anything?
So Mr. Chairman, so the SIM workshop is in August, August
Yes.
23rd and 24th. Yeah, okay.
I didn't hear that
No,
comment.
I was just asking the dates on the SIM workshop, the strategic intercept mapping
okay.
for the mental health.
Sure.
So
Okay, anything else? All right.
that's good.
Sarah, thank you.
Thank you.
All right, let's go on. Number 4, action to authorize chair to sign a lease agreement with the SDSU Extension Service. If you look in your packet, the contract is in there. The first page, it says extension. Having worked on that with